Welcome to the Etalo video on the basics of drilling bone. And in this video, we will learn about bony anatomy, how to drill bone, and some of the pitfalls we find when you drill bone. For example, slipping, drill breakage, and plunging. In this simulation, we shall use the human tibia, which is the larger of the two leg bones and is the most common bone involved in bone infections amongst children and open fractures in all ages. Learning how to drill this bone is an essential and potentially life-saving surgical skill. The skill of drilling the bone is a prerequisite for a number of other critical orthopedic interventions, which include making a bony window, which is called a corticotomy, which is done to open up the bone and drain pus in case of infections and debride the necrotic materials therein. External fixation placement and internal fixation placement as well for fractures and other conditions. The ends of long bones are wider and flare up, and these are the ends that we call the metaphysis of bone. They are usually composed of spongy-like bone, what we would like to call the cancellous bone. The cortical bone at the metaphysis is much less thick compared to the cortical bone around the shaft or the mid portion of the long bones. The middle part of the bone is what we call the diaphysis, or the shaft of the bone, and this area of the bone is dense and resembles a hollow tube. As you see across the section of the bone, it changes from circular to triangular as you move from one end of the bone to the other. This is important to remember, as you will have to be aware in which direction you should drill at the different levels. This is covered in detail in the surgical anatomy section. When drilling the bone, the side closest to you is referred to as the near cortex, and the one farthest from you is referred to as the far cortex. We generally drill the bone with the drill bit perpendicular to the surface of the bone. This minimizes drill slipping or skiving, as slippage of the near cortex makes it so that you can't successfully drill into the bone and resulting in you injuring the surrounding structures like the nerves, muscles, and blood vessels. Let us note that there are two planes that you have to keep in mind while drilling the bone. For starters, we aim to drill perpendicular to both in the longitudinal and the horizontal sections. In some more advanced skills, you need to drill at an angle or in both planes. There is usually a narrow cone of deviation from the 90 degrees that can allow you to drill successfully, and we think that this is between the ranges of 10 to 20 degrees. If you exceed this limit, you will slip. This cone can be increased by drilling a small divot, or rather what we call scoring of the bone, as you can see in the demonstration. The small divot in the bone allows for the drill more tilt and allows less slippage, as you can see. And this is useful as sometimes we'll need to change the drill at a more acute angle. This is a more advanced skill that you can develop in the future. Tactile feedback is a critical aspect of bone drilling, as the drill has to feel like an extension of your arms. There are different feelings that you get when you start drilling through the thick cortical bone and when you are about to exit the bone. As you drill through the near cortex, your drill will reach a point where the tip is about to emerge into the hollow section of the bone. We refer to this hollow section as the intramedullary canal. As the drill enters the canal, there is less resistance to the forward movement of the drill, and the tactile feedback and sound of the drill will actually change. This is important to note, as an advanced skill of drilling is to stop drilling at this point, since you are about to clear the cortex of the bone, and this will help you to avoid plunging. Plunging is when the drill goes far past the layer that you're supposed to drill. In some cases, or in most cases, plunging is dangerous, especially on the far cortex because of the anatomical structures that can be injured. The canal itself is safe to drill across, so if you plunge into the canal, you'll just hit the far cortex. But practicing not to plunge on the near cortex will help you develop control necessary to avoid the plunging on the far cortex. Once you enter the canal, you'll note that the drill has a certain wiggle to it. You can tilt it ever so slightly from the original trajectory that you are drilling. If you do not follow the same trajectory that you are drilling, the shaft will drill the far cortex in an asymmetrical manner. And this will put stress on the drill bit, which could result in it bending or breaking. We call staying in this line with your previous path of drilling being collinear. The goal when drilling across both the far and near cortices is to keep your drill collinear. As you start to drill the far cortex, you should be mindful of your trajectory so as not to break the drill bit. On this far cortex, the most important skill is not to plunge. Unlike drilling the near cortex, things are a bit different with the far cortex because there are no hard structures to stop your drill. And if you drill beyond the far cortex without any limitation, you could damage some vital structures that are on the back side of the bone, including nerves, arteries, veins, muscles, and tendons. The structures you could damage depend on which part of the body you are drilling. And you can look up the relevant anatomy in any cross-sectional anatomy book. As you drill, you'll feel or hear the change in pitch of the drill, and the feel will change in the tactile feedback. You can now slow down your drill if you need to and control the exit from the far cortex so as not to plunge more than a few millimeters. In this case, we recommend 5 to 10 millimeters. Learning to prevent a deep plunge is a critical aspect to bone drilling.